So you heard the professional Maria Trusa. I'm going to tell you a little bit about me because I think it is important so you understand my mission at this point in my life. I am an immigrant from the Dominican Republic. I came here at the age of 15, and I was blessed enough to be able to transform my life and fulfill the dream that we are all looking for. As an immigrant, we all come here to better our lives. And the challenges that we confront are hard, and life is difficult for an immigrant. I can tell you that my dream in my family in the Dominican Republic, we have many doctors, and my dream was to be a doctor. But I became a mom at the age of 20. I was a single mom for 17 years. In that dream, I realized that it was going to be extremely difficult. But I got into the medical field because that was my dream, to be in it. It didn't matter what I would do. So I became a medical assistant, and I started working for a Jewish community in a Jewish practice. And I was very young with a heavy accent, and I'm in the middle of being the only pretty much Latina at Scarsdale Medical, a prestigious practice for many years. And for 26 years, I went from being a medical assistant to being a manager to being the executive director for 24 years of my career there. In 2014, I became very ill. I had I had 5 operations in a month and a half, and my life changed. I was in turmoil, by the way, for most of the years. I would say 15 years. My last 15 years, I was looking at healthcare the right way. We provided healthcare for the affluent community, and it was wonderful. And I saw people actually waiting to get an appointment for a physical exam. They would book their physical the time that they got the physical for the next year. And I was blown away because my family, that wasn't the case. I come from a very poor background. I was able to get to levels that my family never got. And I dealt with the immigrant population. I had many people that didn't have access to insurance. And I tried to help them. And I was able to help many of them, but I knew that I couldn't, that I was limited at Scarsdale for me to be able to do that. So in 2015, I said, I'm leaving my job. Everybody in my family, by the way, including my mother, thought I was going through my midlife crisis because I just turned 50, and I said, I can't do this anymore. And I don't really care about the money that I was making. It didn't matter. Money just didn't matter to me. When I saw myself leaving this earth and realizing that that day could have been my last, I said, I'm here for a bigger purpose. And I realized that the years that I spent as Scarsdale Medical Group were actually preparing me for what I'm doing now. So I went on this journey, and I said, I'm going to have my own medical center where I can make the decisions, where I can go out of the box and create a space where the immigrant community, especially the undocumented population, could have a voice and they could have access to healthcare that is affordable, that is accessible, that is dignified. And I was blessed enough to find my partner, Gina Capelli, who's in the room. And Gina joined me, and ironically, Gina comes from a very affluent community. So you have a combination of both spectrums. And we joined together for a unified purpose. And we've been going at this since 2015. And I want to tell you a little bit about what we have done. So we have been focused on how do we educate this community? Because, by the way, in the Dominican Republic, we don't talk about preventive medicine the way we do here. We don't talk about having a colonoscopy at the age of 50. We just don't talk about preventive care. So instead of complaining about the community that they're unhealthy, they don't really do the things that they're supposed to do, Gina and I decided, how do we educate them? So, social media. I've never been on social media, by the way, before I came and joined my business partner. So I have a Facebook live show that I go on live every Monday at 5 o'clock, Reflexiones con Maria. So I wanted to reflect with me. And the reflections are, I try to give as much on medicine, but you need to keep it interesting because we like to be a little crazy. So the shows, I pick many, many different topics. But I'm always sending a message. It is important to take care of yourself. You're taking care of yourself, you're taking care of your children. You're creating the example, but they're hearing it from an immigrant like themselves. And they're getting the point. They're getting the point. Why is it important to have a mammogram? Why is it important to have a colonoscopy? Did you know? Did you know at this age is when you're supposed to have a colonoscopy? Guess what? They don't know. So we need to spend more resources in teaching this community, educating them, and being culturally sensitive. We need to understand how can we get them to absorb the data, everything that we want to give them. So we have 2 shows, and now we post every single day on Facebook, Instagram, LinkedIn. And LinkedIn, I'm using it for a voice. I want people to hear that we need help. We need to be educated. Who's in LinkedIn? It's not the people that I'm helping, the uninsured community. It is the people from government. We've been able to go and speak with government. There are people that are educated. There are people that are trying to also make a difference. So we've been blessed enough because we have created a mission where we have doctors that are joining the mission, not because of how much money they're making. They are doing it because they want to make a difference. Recently, I have to tell you a little story. There is a Dominican cardiologist that came to me and he said, I've been watching you, I've been following you on social media, and I love what you're doing and I want to be part of it. And he said, and I said, well, you know, we are caring for the uninsured community and you're a cardiologist. You guys make a lot of money, so that's not going to happen here. And he said, money will come. He said, I want to make a difference. I want to join you on this effort. And the irony is that when we go and ask, at Scarsdale, I was able to meet many specialists. I was able to be the source of referral for many of those specialists. So what I did was, I went with Gina and we went and asked them to help us out. We said, how about charging Medicare rates to this community? Because I'm not sure if you guys know, but when you go and you don't have insurance, you are paying 300% of what Medicare pays these doctors. When you go to the hospital, you're paying, and I'm sorry, but that's transparency. When you go to the hospital, you're paying, it could be $700, it could be 800% of Medicare. So if Medicare pays the hospital $100, the hospital will take it, but if you are a patient without insurance, you can pay $700 to $800. And that is across the board. And that is not something that I'm inventing. You can look it up. That is the way that we do business in healthcare. So what happens to these patients? They're afraid to go to the doctor. I had a member, I'll tell you a story. We had a member that went to the hospital by mistake because and we'll talk soon about our program that we've created. But with the program that we've created, our members can get a mammogram for $100. And we have 2 places that they can go to. And by the way, we're very small, so we're talking, but we're getting bigger though. We have 10,000 patients so far. So it is an honor for me, and I have to say this, I wanted to say it at the beginning, to be here with these amazing organization, and these little 2 women in Westchester County are making a difference. And we're very, very proud to be here and speaking with all of you. So the lady went to the hospital by mistake, and her mammogram, she came with a bill that was $1,300. $1,300. Now thank God we have connections, so we took care of that. But normally our patients pay $100. What happens to that patient? she will pay the bill, because if she's sent to collection, they're afraid. They're so afraid. They will not eat or do whatever they have to do to pay that bill. Now, she'll pay the bill, she will not come back to have a mammogram. You just lost an opportunity to save a life there. This is what's happening across the board. I can tell you so many stories. There is one story that for me is it sort of solidified the mission. We had a man that was a dishwasher at a restaurant, local restaurant. He became a 4-Main member. The man comes in, he could hardly see, and he could not fill out the form. Our staff, by the way, they're all bilingual. Everybody in our medical center has to be bilingual. Most of the doctors, including doctors that are Americans, they actually speak fluent Spanish. And I'm concentrating with the Spanish community, but obviously in our center, everyone is welcome, everyone. And we have a pretty diverse patient population. So we have this patient that comes in. I send him to the eye doctor because he couldn't see. The eye doctor calls me, who is my eye doctor, and he says, Maria, he needs surgery, he needs cataract surgery, both eyes. What do we do now? And I said, well, you're gonna help me figure it out. His son happens to have, he has an operating, an Article 28 facility where they do surgeries. And I said, please, let's help him out. We need to figure a way to do this. Let's talk to your son. And he actually ended up, to make a long story short, doing a surgery that could have cost him $6,000 to $8,000, and he was not going to be able to get it done. But he's an immigrant, undocumented, and he cannot get insurance. He cannot even get Medicaid because he doesn't qualify. So we were able to do the surgery for $1,600. And I went to the man and I was so happy. I'm like, guess what? This is what I was able to do. He says, I only have $1,000. He says, every penny I get, I send to my family in Peru. And I have 2 children in Peru that are going to college, and I cannot afford to have the surgery. I don't have $600 more. So I went and I asked my brothers, and I gave $300. And from there came an organization that we just got a verbal approval from the IRS, which is called Promise to Aid, that is going to be raising money to be able to pay for surgeries like that, because I realized I cannot continue asking my family to support this mission. So nobody would want to talk to me anymore. So we started, and by the way, he had the surgery, he's able to see, and he became a cook in the restaurant. And when we walk into that restaurant, it's like God walked into the room. We changed his life, not just his life. We changed his family's life. He's able to send more money, and he's able to spend more money himself. So stories like this, I could sit here and tell you tons of stories. And that is why when I wake up, I'm always excited. People look at me and they're saying, are you ever not happy? I'm like, are you kidding me? How could I be unhappy? When I wake up, I open my eyes and I go to our medical center and I see these families that we are impacting. That is life. Life is about a mission. We all come here with a mission. And ironically, together, we can do so much more. And these little 2 women in Westchester County are impacting so many lives, because we have 10,000 patients, but those patients have families. With the program that we created, and this was just us truly focused on how do we help the uninsured community. We created what's called a medical membership program. And the program, for a small fee per month that is affordable, we have 3 membership programs, and it depends on what you can afford. You can get access to an urgent care. We have an urgent care facility. We have internists, we have gynecologists, we have podiatrists, we have neurologists, and pretty soon we'll have a cardiologist. and we have physical therapy. And how are we doing it? People say, how the heck are you making any money? Well, guess what? It's been freaking tough. We're not making a lot of money, but we're not here for the money. We want to make sure this program sustains itself. And that's our goal. We want to make sure that we can sustain the program. Gina and I have put our heart and soul and money, everything, into this vision because we know that it will work. Because it is not our mission. It is God's mission. So with the program, you're able to access the urgent care, unlimited visits for a small fee per month. And that small fee gives you access to discount throughout Westchester with all of the specialists that have joined this mission. Together we can do more. We are in what we said is, please charge them Medicare rates, but actually, can you charge them 90% of Medicare? Because you don't even have to bill Medicare, because these patients are paying you. This population is working. They're working 2 to 3 jobs because they cannot afford, they don't get government social services. They don't qualify. So they have to have 2 jobs, 3 jobs to be able to support themselves. And the irony is they are able to support affordable health care, not the health care that is inaccessible. The other thing is that we are making sure that we're open late. We're open until 8 o'clock every day, Monday through Friday. We're open 365 days a year. Why? Because this community is working so much and they cannot take 2 hours, 3 hours. And unfortunately, I don't know about you, but if you go to the clinics, they wait hours, 4, 6 hours to be seen, and they just cannot afford it. So what do? They don't go to the doctor. They don't do preventive medicine. But we are seeing that when we concentrate on not the issue, because we all know healthcare is the number 1 cause of bankruptcy in families in the United States are medical bills. So, and with this community, by the way, like I mentioned before, they're going to pay you because they're so afraid. They're so afraid. They get a collection letter, and we deal with the issues. We have been able to get Quest Diagnostic to join our mission, and they're giving us 80% discount for all of the members. We have a local pharmacy that's giving us 70% discount. And the people that are actually calling us because they want to unite this effort is actually breathtaking. I'm blown away. If we just have to get creative, and we definitely have to get very culturally sensitive. So I am going to close today by asking any of you if there's any doctors here doctors on the make, or doctors that want to be part of something amazing, please join us. Gina and I will be here. We'll give you our cards. You can come and join us because we are on a mission to change healthcare. Thank you.